Hey guys, so this is the final episode of Truth Be Told. And in all honesty, it's been an incredible 8 years. I've had a lot of fun doing this podcast. I've enjoyed it a lot. I've learned a lot. I've done a lot. I remember, when I started the podcast, my baby was oldest was actually just being born in 2017, and in 2017 I sat there with Dr. Craddock, who was my first co-host, and we were just hanging out. We were talking about how a lot of patients really don't understand dentists. They don't understand what we do. They don't understand if we're even real people, right? They think that all we do is talk about teeth and stuff. And so we basically came up with the idea of doing a podcast so that we can kind of show the behind the scenes. But we wanted it to be very honest because one thing about dentists is we always want to look good, but I'm not sure if we're always honest with our patients, honest with our colleagues, honest with our friends, even. We try to live an extravagant lifestyle, an Instagram lifestyle, but I'm not sure if we're actually honest about what's really going on. And so when we started, I would tell stories about my life, he'll tell stories about his life. But in the end, it came down to one thing. It came down to being completely genuine and honest. And it's been 8 wonderful years. Uh, but this podcast needs to end. So let me go ahead and just rewind time a little bit and tell you basically how Tooth Be Told was created. It was created out of necessity, out of need for truth. Dentistry was really good, but I could tell it was going down the wrong path, just in my own opinion. And so I wanted to shed light on what I noticed, what I was seeing with corporations, what I was seeing with dentists, what I was seeing with the quality of work. And as a specialist, you get to see everybody's work. You get to see everybody's attitude on dentistry. And somebody like myself, I always believed that I was very blessed to be a dentist. And when I say that, I really, really mean that because, when I was in undergrad, in my first semester, I had failed biology. And you would think that biology is probably the one class you cannot fail. And I failed it. And so I had to retake biology. And so that was something that held me on, held over in my GPA and everything else. But the University of Pittsburgh gave me a great opportunity when they accepted me. Come to find out later on, other schools accepted me and wanted to give me the same opportunity. And I was so happy and so lucky to get the chance to be a dentist, something I've wanted to do since I was 10 years old. I broke my tooth and my childhood dentist actually fixed my tooth, and that really sparked this interest in dentistry for me. And when I went to school, before I actually went to school, I worked in the medical library. So I got to see a lot of the dental students. And man, when I say was I envious of them? Absolutely, man. They're wearing their baby blue scrubs every single day, and I get to see them and I get to talk to them. And, yeah, they weren't the most excited because they were steady most of the time when I saw them, but you could tell that they were in an elite group, at least in my mind. They were in an elite group. They were going to be doctors, they were going to be able to help patients. And so that's something that I really took personal, and I went to dental school and I started dental school, and my first semester was hell. I put so much pressure on myself to be like the rest of my classmates, to be top of the class and everything else. And it really did not go well for me because I was miserable to the point where after my first semester, I wanted to quit dentistry. I wanted to leave dentistry, but I was told by an advisor, if you quit dentistry, it'd be the biggest mistake. And she reminded me that when I was applying for dental school, that's all I wanted to talk about was dentistry. When I applied for dental school, all I wanted to do was get in. And now I've been given the opportunity to get in, and I want to leave it. I wanted to quit. So my buddy, my main man Chris, Dindal, uh, pulled me aside when we came back from school and said to me, "Hey, Walt, I want to do something." And I was like, "What's up, man?" He goes, "Let's not check our grades anymore. Let's not even look at our grades. Let's just study and take the test and do our, do all our hands-on stuff without even knowing how we're doing. And I was like, that's crazy because you're obsessed with grades when you're in school. You're obsessed with grades. You think that that's your bubble. That's your life. And then we all, after class, after taking the test, we all go outside of the lecture hall and we just compare notes. Oh, what did you get for B? What did you get for 12? What did you get for 13? What did you get? Oh, I got B. I got C. This, and it becomes neurotic and it becomes psychotic. And so he basically was like, let's not do that. We take the test and we move on. We will know if we are still in dental school because somebody's going to come to us and says, hey, you guys are failing. And that's when we will know we're not doing that good. And if they don't come to us, then we know we did all right. And so we continue that path all the way through school. And to this day, I don't even know how I did in dental school, but I know that I put in my effort and I actually try to learn everything. And I think that's what's missing is a lot of people just go through school just memorizing stuff. And then later on, they can't even apply it or don't even remember what they learned. But yet, patients depend on us to understand the science and why we're doing what we're doing. And I honestly believe that that's not the case anymore. Most dentists don't understand or know why they're doing what they're doing. They are dependent on the reps who it's their job to sell you stuff. That's who you guys are dependent on to do dentistry. Use this product because everybody that you like says it's great, or use this product. So they're basically like they're not scientists. They're salespeople, and that's who you're dependent on. And then they'll give you research and say, "Oh, well, our research shows this, this, and this." But when you look into the research, you realize that they paid for that research. Who will ever get money from a corporation to talk bad about that corporation? It doesn't make any sense. So that's something that I realized was happening. And I hoped that when Tooth Be Told came through, that people would actually get smarter, would want to challenge themselves, and would want to do better, not only for their profession, but for their patients. And that's not the case anymore. Nothing has changed. After 8 years, nothing has changed. If anything, it's gotten worse. More and more people are more confident than they are, and they're confident and they're cocky, but have very little knowledge and skills. And I'm not trying to hate on everybody. It's most dentists. I get a lot of dental referrals, and you'd be amazed how little patients, how little the referring dentists understand about dentistry. And I would love if you would all just stop, take a deep breath, and go back to what we used to do, which is actually, clinical based, knowledge based treatment of patients, not what you think might work, what a mentor of yours told you would work, but actually base it on facts. Dentistry is the only health profession I feel like that we just do stuff. We try stuff to see if it's going to work versus actually basing our work on facts and good research. Anyway, so I get through school, I finish everything, and I move to do my GPR. And my GPR is basically, um, think of it as an extra year of dental school where you get to see more patients, you get to do more procedures. In my first day of clinical work, I had a root canal on a molar tooth. And I was drilling, 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 and sure enough, I drilled straight through that tooth because I was either anxious or just didn't stop to think because I had the knowledge. Before I could even touch a patient, I had to read tons of articles. I had to do a bunch of stuff. I mean, test upon test upon test. So my first day, I'm ready for this root canal. I know I can tell you how many, MB2s and all this other stuff. I could tell you all these different things that go on with that tooth. But one thing I didn't do is I didn't slow down and I didn't stop. So when I perforated it, man, it shattered me. I was like, my God, I'm not going to be a good dentist. This is going to suck. I'm going to be miserable. Like, why am I even doing this to myself? And don't forget, at that time, I mean, if anybody knows me, they know I am very, very confident, cocky sometimes, confident, very much so. And so for me to sit back and go, man, this sucks. Like, I can't believe I did that to that patient. I mean, luckily I had probably one of the best endodontists that I know. Um, he was the chair of the endodontic program, and he went in there. He put um, medication in there, and everything went well with that tooth, and held it. The tooth held for a while. But yeah, he had to bail me out. Now, this is somebody, and I'm talking about myself now, who had backup. I knew I had backup. I knew that if I messed up, somebody who has years of skills, of actual endodontic skills, and years of practice, and I mean thousands upon thousands of endo that he's done successfully, could bail me out. Mind you, when students graduate, there's two options. You can go to residency, three. You can go to residency, specialize, go into the Army, Navy, or you can just go straight to work, right? So that was four. I'm sorry. The people that go straight to work, I don't know how you do it. I don't know how you do it because when you go to work, you have become a tool in the toolbox for somebody else. When you get hired by a corporation, when you get hired by a dentist that owns a practice, they're not hiring you because they want to slow down and teach you the right things. They want you to go. You need to make money for them because they are paying you. In residency, they were paying me, but it was very minute. It was very small. But the point was for me to learn. And it was okay if I was uncomfortable with something because the the director, the different chairs would come in and help me out. Most of the time when you are in an office, the person you're hoping to help you out is also very busy with their own work. The person that you're supposed to be getting mentored by is more than likely not going to have the time to properly mentor you or may not know how to do the procedure properly. When I did, for example, the root canal, I had the chair of the endodontic department, the person that graduates other endodontists, as my go to. When you do a root canal and you haven't taken the courses and you haven't been taught properly by good clinicians, you're guessing. And the person that may be mentoring you may be doing exactly the same or may not have the experience. So I don't understand how it is possible for us to basically use patients as almost like guinea pigs. I know this sounds depressing. I know this sounds crazy, but I honestly think we need to stop and slow down when it comes to what we're doing. Most of the time, people who graduate don't have the skill level to do what they're actually doing. I had a doctor a while back and I had treatment planned. I said, okay, this patient wants a bunch of crowns, basically a full mouth, crown on every single tooth. And I said, oh, who's your dentist? And they were like, oh, it's so and so. And I said, cool. I go to the doc and I say, hey, you're a new doc. This is incredibly complicated. I mean, I'm talking about prosthodontist level complication. I go, do you want to send it out to a prosthodontist? And they looked right in my face and they're like, no, I can take care of it. And I said, oh, have you done this? How many times have you done this kind of procedure? Because it's a big case. Oh, no, no. I mean, I know about it. But how many times have you done it? Have you waited to see the complications? Because there's so much that you're gonna mess with people's jaw. You're gonna mess with people's bites. You're gonna mess with people's happiness if you don't do this right. So how many times have you done this? Oh, I know what to do. Don't worry about it. And I go, okay, let's talk about it. I started going through. Oh, did you consider this? Did you consider that? And I left going, I'm gonna pray for that patient because you don't know what you're doing. But it's amazing how people will convince themselves because in the end, they're thinking, I need to be productive, right? Because they're an associate. I need to be productive. So when it comes to being productive, I need to do what? I need to just do anything that comes into the office. Even if it's above my pay grade, I need to do anything that comes in the office. Again, I say this, we got to slow down. I'm not trying to be negative. I'm not trying to be a Debbie Downer, but it is the truth. I've seen so much. And in these 8 years of doing the podcast, if you put it all together, and please don't do that. It's like over 200 some episodes. I don't think you want to listen to all of them. But if you want to listen to how to do things properly, if you want to listen to my biggest gripe, that's probably one of the biggest ones is we do things when we're above our pay grades and we don't know what we're doing. And the only people that end up suffering are patients. And I want to make sure that we can do better. Dentistry is an amazing profession if you allow it to be. I get it. When I graduated, I was when I finished my residency at GPR, I worked for a corporation and I was by myself. And the first 3 months were hell. I literally had no clue if I could do it. It was exhausting. It was mentally and physically exhausting because I was running everywhere. I was seeing multiple people at the same time, and I did not know what I was doing. But all I kept saying was continue, just push forward, push forward. And it started clicking in. But one thing I did was I would say, you don't want to see me. You want to go see the specialist. You want to go see this person. You want to go see this person. The funny thing is, the more I did that, the more patients actually trusted me. And I was still busy enough to be productive. I know we have this fear of missing out. We have this fear that we gave up our 20s, so we need to get paid. It is time for us to drive the Bentleys. It is time for us to go on that expensive vacation that you see other dentists going on. And I really, in my heart, believe that give it time, be patient. The money will come. But once you mess up your reputation, it is going to be impossible to get it back. Patients aren't stupid. If you don't know what you're doing, if you're not confident, I'm talking about good confidence, not just, oh, I'm just going to pretend to be confident and act like I know what I'm really doing. I don't. People can kind of read BS. They can read bullshit very, very well. Some people can't read bullshit at all. Let's be 100% honest. Some people are just plain just like naive. But most patients can actually see that, yeah, you don't know what you're talking about. And patients, if you really want to know if a doctor really knows what to, ask them questions and see how they respond to it. If they get very defensive, I'm telling you, run. No one should be that defensive when you're just trying to get information for a procedure that's going to be done on you. If you ask people questions and you don't feel like they have the time to sit down and explain stuff to you, you are nothing but a number that they need to check off to go somewhere else. And I hate to say that. We all fall behind schedule, we all get busy, but if we care about patients and making patients understand what we're doing, then we got to stop and actually treat patients like they're people versus numbers or versus, oh, this is going to be my total for this production. And I see that more and more. Let's pack my schedule full of all kinds of craziness. And the only people that end up being miserable, not only are actually the only two people, are the dentists. If you're an associate, you're the dentist. And then also the patients because you didn't take the time to do things right. There's no way that a doctor can see, 30, 40, 50, 60, 70, 80 patients in a day and do things right. It is impossible. And if somebody thinks it's not, contact me. And I can guarantee you I can break it down to the point where You can't even say anything because I can prove to you it is impossible to do a great job on every single patient, up to 70, 80, 90 people. It is impossible. You're going to just basically do something wrong, move on, or the quality of dentistry is going to be garbage. So we have to slow down. Have you noticed that I keep saying the same thing, slow down and think. I keep saying that for a reason. We're not doing that. We're going, going, going because in the end, all we want is the almighty dollar. I know insurance is not helping. I can tell you insurance is not helping. I know we get screwed over a lot by insurance. Patients, if you have insurance, don't think that they're on your side either. There's so much that insurance just screws you guys over. And things that you will pay for. You think you're paying. I've been paying consistently. How come it's not covered? How come this is not happening? And then when you call them, they try to put it onto the doctor. Your enemy is not us. Well, most of us. Some people, yeah, yeah, no, they're crooks. But your enemy, most doctors are not your enemy. Most of the time, it's the insurance trying to figure out how they can screw you over. Oh, you had this work done, but we need the doctor to do jump ropes and backflips and stuff just to get you the information, just to get you the money to pay for your stuff. Well, oh well, we would pay for it, but your doctor didn't do that backflip correctly, so therefore we can't pay for it. Go blame your doctor. Oh, but wait a minute, I pay my insurance every single month. And I've been paying it every single year since I've had coverage. And you're telling me you want to do everything possible for me to have to come out of my own pockets versus you paying for it. I'm telling you, that's what insurance is like. So I get, and I know I keep going back and forth to my story and rants, but I worked for a year and it was a great year. I mean, I had a lot, I have my two assistants were incredible. They were awesome. They cared a lot, actually cared about me. That was something that surprised me how much my assistants cared about me and my well-being to the point where they knew that I loved extractions. So if I had a tough week, they would, in my front office and my assistants and everybody would basically try to figure out how we can add more surgeries at the end of the week, so that Friday, so that I could just chill, listen to my music and play. And I really am so grateful for them. To this day, I still know a lot of, I still remember them, and I'm so grateful. I really am. I'm so incredibly grateful. But man, that's not the case anymore, is it? Guys. I mean, I'm talking to the doctors now. There are a lot of assistants that come in just to just clock in and clock out. That love of what they do is not there. That appreciation to patients is not there. I hear assistants in the background complaining about, oh, this patient's asking too many questions, da da da. Da." Well, if it were you, what would you do? Would you just agree with people just so that they don't inconvenience your time? I honestly believe, and you guys can all check me if I'm wrong. Please tell me, and I will 100% apologize. But I feel like COVID brought out the worst in us, brought out the worst in a lot of. I know a lot of great assistants that ended up just leaving dentistry because they were like, "I'm done. I can't deal with this anymore." I know a lot of great hygienists that left dentistry because they said, "I cannot deal with this." And then a lot of bad assistants came through, and a lot of bad hygienists came through, and a lot of bad doctors came through. COVID, no one was properly taught anything. So you graduated and you hadn't even touched a patient, but yet you're going to then go treat people. That doesn't make sense. You're in dental school, you didn't even touch patients, you barely saw anybody. Everything was done on machines and Typodons. I say Typodons, but some people say Typodons. But it's just basically a mannequin head that had teeth in there, and you drilled on everything like that. But how is that real world experience to the point where you come out and now you have to do work on patients, you have to talk to patients? I feel like people aren't good at communicating anymore. I feel like people aren't good at being patient anymore. Everything has to do with them, how they feel. But the patients are paying us to do our jobs. They're not paying us to be irritated with them. And don't get me wrong, there are a lot of asshole patients out there, and there are a lot of asshole doctors out there, and a lot of asshole assistants and hygienists. And I'm not saying you can't be irritated by people. What I'm saying to you is it's still your job. And you can always tell the patient, hey, look, if you are not happy, go get a second opinion. You don't just have to deal with it. Like I know if you're an associate, they always want you to work, 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 but you also have to think about, is this beneficial for me? Is that patient that's already mad for whatever reason gonna be beneficial in the long run? Or are they gonna be a headache? We have to understand what we're doing. We have to hopefully wait for patients and for patients to understand what's going on. We have to wait. We have to be patient to explain to them what's going on. And if you don't have the time to do that, don't blame the patient for being irritated, angry, or whatever it may be. That's you, docs. And for you patients, be patient. I know I keep using that word, but understand that we have a lot on our plates too, and we're normal people. We have bad days. We're not, we're not, circus characters. We're not gonna sit here and just put on a fake smile and hey, for you. There are days we have bad days. So sometimes you have to give us grace. And you have to make sure that you understand that we're people as well. Truth Be Told was all about making sure everybody understood that we are people as well. I graduated from, I graduated, worked, and then I went back to specialize in periodontics. And perio is probably one of the hardest specialties to explain. It's probably one of the hardest specialties for people to understand because they know what an oral surgeon does, right? They take out teeth. They know what an endodontist does. Oh, they do root canals. They know what a pediatric dentist is. But ask them what a periodontist does, and man, it's a gambit of, yeah, you have gum disease. Cool. Sad part is that's actually what most doctors think too. Most dentists, when they refer, they go to the periodontist. Your gums are red. Your gums are bleeding. Go to periodontist. Let them take care of you. There is no explanation to patients, and I got patients who are very dramatic. I know they'll come in and say, "No one said anything to me." I don't believe that a lot of the time, but there are times where I'm like, "No, you really didn't get anything explained to you. They just told you to go, huh?" Yeah, that's very true, and that happens. So patients don't. I mean, I appreciate the trust, but you don't know me. So just, ask questions. When you go see any specialist, ask questions. If they don't have time to explain to you properly what's going to happen, or if you have additional questions, unless you're in pain, you can slow down, stop, and don't do anything. You don't have to do anything. Understand what you're getting yourself into with any specialist. And especially as we have to slow down and make sure that we understand how to explain things to patients. And whatever it takes, if it takes a three-dimensional image, CBCT, an X-ray, a bite wing, whatever it takes, models, we have to do better. We can't be upset because somebody now is asking too many questions and is slowing our day down. That means you just didn't plan properly. I usually don't do consultations and treatment at the same time. I do only consultation or only treatment because I know once a patient sits down, you're probably going to have a lot of questions. And it's my job to explain those questions and make sure that they leave with as little confusion as possible. I'm not perfect. There are times where I get irritated because I'm like, that doesn't even make any sense. Where did you learn that? But it's still my job to make sure the patient understands. They may not agree with it. And I'll just tell them, go get a second opinion, go somewhere else, do you. But one that I'm not going to do is I'm not going to sit here and pretend that my patients don't have the right to pick whoever they want to pick. I am not that special where I have only exclusive rights to that patient. That's not the case. And when I went through periodontal residency, I learned so much. And the one thing that I learned is we're not perfect. And it was taught to me by Dr. Family, an incredible chair and person. She made us do our own deep cleaning SRPs so that whenever we went to do the next step, which was the surgery, we would see how much we missed and to understand what our hygienists go through, to understand what our referring doctors go through, and to be okay with going, you know what? They're not going to do an all out perfect job because they're limited. We get to be uh, uh, basically bystanders and reflect the tissue and see what was already done. And to judge people based on things that you don't even know happened was something that I was taught very early on. You don't judge, you just basically do what you need to do to help the patient. Us specialists, we are very good at judging. I have a bunch of friends who are specialists. My God, all we do is judge. The funny thing is, there's no one to judge us but our own colleagues. And I can guarantee you we're judging. We're judging each other. And I can guarantee GPs are judging us. General dentists are judging us. But man, do we judge and do we complain? And the funny thing is, as specialists, we depend on the general dentist for our livelihood, but yet we complain about the general dentist. And we depend on patients to accept us with very little interaction. We haven't met you before, and you are coming to us because your referring doctor trusts in us. But us specialists, we have gotten so comfortable with thinking that we are better than that we have forgotten who really helps us make a living, the referring doctor and the patients. Most general dentists think that specialists are cocky sons of bitches. And I actually agree sometimes. I really, really do. And that's coming from somebody who was a specialist. I agree that we are incredibly cocky and we're incredibly just arrogant. Yeah, the specialists, as a specialist, we know more because that's all we do. We know more about root canals. That's all we do. We know more about periodontics because that's all we do. Periodontal disease because that's all we do. We know more about oral surgery. That's all we do. General dentist, to be a general dentist is probably the hardest thing you can possibly be because you have to know so much. You are a jack of all trades, master of none. And I wish general dentists would understand that. It's okay not to be master of all or even any and to refer out. To feel like I have to keep and hoard everything in. Hoarding is a disease. And if you feel like you have to hoard your patients, either you are very, very naive or you have a problem and your confidence in your actual work is gone. So you don't want anybody else to see. If you don't want to refer out because you want to do everything, think about how stupid that is. You are not going to ever do anything as good as an endodontist, a periodontist, an oral surgeon, whatever. You will get to that point. I'm not trying to be disrespectful. And let's just say that you really do well with oral surgeon. There are general dentists that are incredible surgeons. I really believe that. They're good at, but you will never see them say, "Oh, I'm good at, surgery and also really good at endodontics." I don't know how anybody could be good at multiple things. I'm talking about mastering multiple things. That's not possible. You could be okay at it. You might be good at it, but mastering, I doubt that. I doubt that. Unless you focus on one thing. And I know a lot of general dentists that will focus on surgery and do very, very good surgery, incredible surgery. But I also don't think that you could do everything to the point where you don't refer out at all and you hoard everything in. There's no way you can master that. And if you can, please let me know. But 8 years, and the only thing that I've gotten out of the 8 years is I don't know everything. I have so much more to learn. Dentists, when they come on this podcast, go from talking so much stuff before the cameras come on. And once the cameras come on, you would have thought that they were completely different people because they're polished and they won't say anything bad about anybody. But yet they were talking so much about people behind the camera. In front of the camera, very different, motivational and so forth. And there are a lot of people that I never posted their episode because I did not believe what they were saying was truthful. We're not very truthful people, you know? And whenever something fails or whenever you have a little bit of following, you basically use that. And I mean this, you use it to basically spin off so you don't do dentistry anymore. You do something else. You're a consultant, you're a celebrity dentist. I still don't even know what the hell that is. Who the hell has what's a celebrity dentist? You saw one celebrity, maybe an influencer, and all of a sudden you're a celebrity. That doesn't make any fucking sense to me. I digress. And the funny thing is, the people that are more vocal are usually the ones that are really bad at dentistry. Like, let's be honest. I see the work online and I'm like, that is garbage. But of course, I will never say anything because it's not my place to go online and troll anybody or comment on any. I don't have the energy nor the time. I got my kids and I have my family. I do not have the time to do any of that, but I'm telling you, patience. If anybody wants my opinion, DM me. I promise you, I'll give you my honest opinion. You can DM me and I'll tell you if I think that's a good case, if I think it's right or not. And if I don't know, I'll send it to other people and they'll be very honest and I'll reply back to you and tell you if it's a good case or if they did something. And most of the time, it's not. But they'll post it with pride, but it's not that good. Man, 8 years. I had a good time. I had a good time. Not all the time. Not all the time. And I'm upset, I'm sad that there are some great co-hosts that could not continue to do it. The Dr. Kradox, uh, Dr. Dennis, Dr. Kyle Dumpert, but, and then of course, my most recent, Dr. Horton. I mean, I couldn't have done this podcast without you guys. I really mean that. And I've had some incredible people that wanted to take the time out of their busy schedule to just jump on here. And everything I did, I never took advertisement. I know people came to me multiple times for me to advertise. I refused to do it because I just thought that if I'm going to do and be truthful, I cannot have people telling me what to do. So, yeah, it's fun. And when I started in 2017, there weren't that many podcasts, especially dental ones. And now almost everybody has a podcast. And so I figured this is probably the best time to exit and stage right and be very grateful for everybody that has stuck with me for 8 years. I really, really, really appreciate you guys. And I know sometimes I complain a lot. But I hope you looked at it as, you know what, he just wants dentist and dentistry to be the best it possibly can. I thank you so much. I appreciate everybody. And I'm going to post this in May because it's my birthday month. And I think it's the best way for me to go out. You can continue to listen to old episodes and you can continue to watch, I mean, even to the first episode, because before it was just audio, then we basically incorporated some videos. So you won't see all the previous episodes. Episode one, you will never see it on YouTube because it was all audio. And we were drinking a lot. So, it was, we had no responsibility at the time or very little responsibility. But I always say this, this is my opinion. You may not agree with it, but it's my opinion. And I have the right to tell you my opinion. I'm not going to say any names to hurt anybody. And everybody that's come on the podcast, I really want to thank you because you didn't have to. You chose to do it. And I want to thank you guys so much for listening to Truth Be Told. It is done. It's moving on to the next thing. And I would probably never post on Truth Be Told again. Thank you for listening, and I appreciate you guys. This is Dr. Aka.